And very important to consider the concept of appropriate lung recruitment. So all of you are familiar with the pressure volume loop, and during the acute phase where there is a less compliant lung, you need more pressure to achieve a certain volume. And then you have the opening up phase. We have the lower inflection point when this starts and the upper inflection point when the benefit is achieved. But after that, if you continue increasing the pressure, the lung becomes less compliant. So this is the C20 by C, and it will be less than 0.8 in this case where there is over distension. But after that, you can drop the pressure without dropping a volume significantly, and this is the principle of hysteresis. And this principle is used in lung recruitment in high frequency. So the importance of lung recruitment is demonstrated here. We have collapsed airway where the blood flow goes across without any oxygen coming into the blood. So this is a right to left shunt because of atelectasis. When you start increasing the pressure, the lung starts opening up and the oxygenation improves. So the VQ mismatch is improving. And when the lung reaches appropriate level of distension, the VQ mismatch is ideal. However, when the lung gets over distended, there is pressure on the blood vessel to collapse, and so the blood flow doesn't come to that area though the lung is ventilated. So this becomes a dead space. So either you have a shunt with atelectasis or you have a dead space, and both these ends of the lung leads to atelectotrauma and barotrauma. So we should volutrauma. So we should avoid both these extremes. So the idea is to maintain the lung around this range with the lowest pressure possible. So in terms of lung recruitment, it's useful to remember Laplace's law as well, where the pressure is reflected by 2 times the surface tension and is inversely related to the radius. So as the radius starts increasing, the pressure required will reduce, and as the volume of the lung with recruitment improves, we can sustain the lung opening with the lower pressure. So this leads to hysteresis. So remember that hysteresis is related to the lung staying open at a lower pressure than when it would have needed when it opened. So this also illustrates the same principle of hysteresis. So you have opened the lung to the stage where you're almost over distending. Then you start dropping the pressure, and you can see the volume here and here at this point is almost the same at a much lower pressure. So the volume of the lung is much better in this point on the expiratory curve compared to on the inspiratory curve. So I will show that better in the next slide. And the shunt fraction, which reflects how much atelectasis is there and how much right to left shunt affecting the oxygenation. So the shunt fraction should be low, and here it's starting to come to the optimal level, and you don't want it to drop below that. So this is the range that you want the pressure to be. You maintain the drop by hysteresis and you have a reasonably low shunt fraction, so you would stop maintaining the pressure at this level. Don't drop it more than that. So this clearly illustrates that during the inflation point, the lung volume is much lower distance, and as it drops, you can see at the same point where the lung volume was low, you have a reasonably distended lung, and this is enabled by hysteresis. So this illustrates to you that the lung volume is maintained reasonably well because of hysteresis. And this is demonstrated by the X-ray where the lung is closed down, it starts opening up, and it's now well inflated. So you don't want over distension as well, so it's important to monitor and manage appropriately. In terms of principles of lung protective ventilation, we have to recruit the collapsed alveoli, stabilize the alveoli during inspiration and expiration. We have to make sure we don't disconnect the ventilator unnecessarily. We have to prevent end inspiratory over distension, use the lowest possible pressure amplitude in order to reduce tidal volume, and use the lowest oxygen concentration possible. So this is the optimal lung volume or open lung ventilation.